Thanks for joining us. This is the very first video-based interview for the PSN-YPG Lagos Prime Paragon. And the Prime Paragon is basically an avenue for us to showcase young pharmacists that are doing exceptionally well, both home and abroad in their choosing fields, whether it is pharmacy related or not. And today we have because a high-flying pharmacist, even though he was recently inducted into the pharmacy profession from the University of Ibadan, where he finished with a first class. He is a global health advocate, a health system researcher with several publications in renowned journals. He is the director for research and global health at Global Health Focus, a student editor at the International Journal of Medical Students, and a research lead at Campaign for Safer Alternatives, amongst many others. We have with us this evening pharmacist Yusuff Adebayo. So pharmacist Yusuff Adebayo, can we meet you? Who are you and what do you do?
Yeah, my name is Adebisi Yusuff Adebayo. I'm a recent pharmacy graduate from the University of Ibadan. As is obvious, I'm passionate about research, and currently I work with Global Health Focus, an organization that is based in the UK that aims to actually advance the cause of global health in Africa and other low and middle income countries. Basically, I also actually work as the research director at African Young Leaders for Global Health.
Okay, thank you very much. So, how was growing up like for you? About family, education, and what particular experiences would you say influence the kind of person that you are today?
I have my primary school education at Emmanuel College in Oyo. My secondary school education at Peace College Oyo, and I also attended School of Science from my senior secondary school education. Basically, for me, like right from growing up, I actually have that mindset of being focused on anything I actually want to do, anything I want to achieve, because I actually believe that one of the things that you can learn anything and you can grow in any area. And one of the things that you actually need to achieve this is focus, determination, and being resilient. And I could remember properly that this is what my father used to tell us, that no matter what, you can always understand this. I remember when we used to do this pest solution. I just feel tired at times. This pest solution in primary school and GSS, I just felt this thing, I'm getting tired. But I remember his words then that, okay, so you can do it, you can do that. Once you are focused and once you are determined, you can always achieve anything that you want to achieve. So that grows with me. I believe that if I actually want to learn anything, I believe that I can actually learn it. So that mindset is actually one of the things that actually stay with me till now.
Wow, so focus, determination, and resilience. Thank you very much. So why pharmacy? How did you get into pharmacy? How did you discover pharmacy? Why pharmacy?
Actually, throughout my stay in secondary school, I didn't even know there's anything like pharmacy. I just felt the only thing that is available based on this brilliant charm is just go for medicine and all. So, but then I just get to realize that there's something called pharmacy, and what actually pushed me to actually choose pharmacy is because um, I'm actually passionate about what I like or I'm interested in. Most likely, I understand this part of you being the best in chemistry and you doing well in biology. So I felt if I go to if I study medicine, I'm going to lose that part of chemistry. So that I just felt is there something I can go for? So I was looking for pharmacy. So it's based on my passion for chemistry and biology. So I think if I go for pharmacy, I'm going to I'll be able to explore that area more.
Yeah, actually hear a lot of people say I chose pharmacy because I was very good at chemistry and biology and that. But would you advise someone that probably those are their strengths to go for pharmacy?
Yes, actually, I
Would
don't
you say
regret
that?
going for pharmacy at all. Like, I will recommend pharmacy anytime, any day to anyone. Even if you know that when you finish pharmacy, you won't be able, even that you're not going to practice pharmacy, but I will still recommend pharmacy to you. Because pharmacy, in a way, has a way to strengthen you, to build that focus in you, and also to be able to provide you with all-round knowledge that you can actually learn anything when you go in pharmacy. So I recommend pharmacy for anyone based on that, because I know pharmacy will actually have the skills, knowledge to be able to learn anything and to grow in any area that you actually want to focus on.
Indeed, pharmacy will. So what were some of the challenges that you had to, or that you faced in pharmacy school, and how were you able to surmount them, especially since you started your career even as a student?
Well, challenges is basically is a challenge actually. Is ability to just be able to manage my time properly. Because I believe that as a student, it's very important that you also build capacity. You are going to
Yes,
leave the university environment, so it's very important that as a student you also build capacity. And for you to build capacity, you have to learn how to actually manage your time. So learning how to manage my time and also doing other stuff is one of the challenges. One of the that I actually face in pharmacy school. So, but then I try as possible to be able to balance things up, because I know I don't just want to finish with B farm. I want to finish with something, B farm with something. So I know I have to actually manage my time appropriately.
So in a word, how would you describe your experience in pharmacy school?
Interesting. I would say interesting. Yeah, because
That
my
was
stay in pharmacy is something that I actually enjoyed. I enjoyed my stay throughout pharmacy school. Though it's challenging, you have to do this, you have to do that. But then I'm happy that I had a fulfilling undergraduate experience.
so even as an undergraduate, you had to juggle academics with a research career, and yet you were still very much involved in school politics. I believe you served at some capacity in PANS, both at the local level and international level. How were you able to juggle all this and still come out with a distinction?
Well, I serve as PANS PRO for your University of Ibadan. Um, then I'm not really actually depth so much into research, but I know I'm going to. That was when I was in the this 100 level, 300 level. I actually go for the post. But then one of the reasons why I actually contacted for the post is for me to learn more about how things worked in PANS, and also to build capacity regarding writing, and also letting my writing know to build confidence and all. So that's one of the reason why I actually go for PANS position. And actually, I was able to achieve that, be able to mix with other students, learn from co-executive, and also gain more experience of how things work regarding policies. So I'm able to get that, and going forward, that's when I actually focused more on research. That was when I was in 300 level, second semester. I tried to build more capacity in research. So it was before then that I actually served as the PR for the organization. But then what I wanted to do, then what I wanted to achieve with the post, I was able to actually achieve them all.
Okay. So how did you get into research? What's the story behind your sojourn in research, so to say?
While getting into research, it was after the Global Health focus. There was a course called Global Health course, Global Health Pharmacy course at IFE. So the facilitator, I met the facilitator, Professor Don LEC 03. He's the facilitator of the course. Actually, when we're having the program, the way he inspired us that students can actually engage in research. Actually, I am passionate about research, starting from the 200 level, I interested in research, actually in pharmacy line then. I was thinking to be a researcher in the pharmacy line. But going forward, I think I can do many other things that are more practical, that can actually solve real problem in the health sector. So then it motivated us so much that if you are that program, you will consider to be an expert in global health. You will consider to be a researcher in global health. And all of us are actually that attended the course then, most of us now, we are doing things related to global health around research. So the starting point for me that actually changed my orientation, that as a student, I can actually engage in research, was after that global health course in IFE.
Oh, okay. So at what point did you realize that it's going to be research, that you are going to build your career in research, or you are going to build a career for yourself in health system research?
After the course, so I started, I told you that I'm actually really in research, but then I'm thinking of focusing on to become a researcher in maybe pharmacology then. So, but when I start to actually read more about global health, it becomes fascinating to me. Because global health, so this is what global health is all about achieving health equity, about actually providing, ensuring that everybody actually have access to healthcare. So all these things actually makes me more to get more interested to go in that line. So when I started reading more about global health, so afterward I met with the professor after the global health course. Then since then, he has been my mentor. I asked him questions, he relates well, and then I started growing, building capacity in that line. But basically, is when I actually when I started to read about what global is all about, what are the areas, what are the scope behind global health. That gave me more fascinated to go to build capacity in that line, because I'm really passionate about achieving health equity, which is one of the core goals of global health.
Yeah, okay. So what area of research your focus? Because of course research is wild. Global health is also a wild field. So what is your focus as a researcher? What area?
My focus actually in global health, we also have some other areas. Particularly, I'm interested in health equity, inclusive health, health policy, health systems research. That's actually my core area of interest. So I try to look at health system, health policy, and actually how they affect healthcare delivery. So that's my core area of interest. And all this is under achieving health equity, making health affordable, making it available, and making it more accessible to people.
So why did you choose this area of focus?
Well, I believe personally, I believe that for anyone, you should not actually have difficulty, or you should not go into poverty because you can't afford healthcare. So it's one of my core beliefs that everyone should be able to have access to healthcare, no matter your financial background, no matter anything, who you are. If you are a sex worker, if you are a smoker, if you are a drug user, anything, nothing should actually stop anyone from achieving or from having access to healthcare. Healthcare is a human right. That's one of my core beliefs. I stand by that no matter what, even if you are an inmate, you're a prisoner, you're in prison, you should have access to healthcare. So if you look at most of my research, I'm trying to understand healthcare system among the marginalized and vulnerable groups. That's one of my core area as well. Because that's my core belief, and that's the core belief of anybody that's actually working in the field of global health. You have to believe that health is a human right, and health should be available, should be affordable, and should be accessible to all.
So health is a human right and it should be affordable and accessible to all. So you have over 75 publications according to your ResearchGate profile. How would you say these publications have affected your primary focus? What result or improvement will you say these have been able to drive?
Okay. But we actually work on a lot of papers that we are seeing the impact. Imagine you doing a study and you having WHO citing the paper in their policy document. So it's something fascinating, and it's something that you see that, okay, this paper will be useful to advance the cause of global health, of international health. So actually work on a paper regarding ensuring access to healthcare among sex workers during COVID-19 pandemic. And this paper, you just see the paper, even if you start the paper on social media, you see people referencing the paper, people citing it to make arguments to their government regarding providing care to the vulnerable groups. And also, we worked on the paper, but actually, in this regard, maybe we are just so we are the one of us do that kind of paper, but then it's in a way it has drive impact, in the sense that we actually advocated for ensuring COVID-19 vaccine to the marginalized population. And interestingly, it's one of the things that global health is, that WHO and other global health bodies are actually advocating right now. That, okay, if we don't actually ensure access to these people, they're going to serve as the reservoir of the virus, and it will also come back to us. So it's also important, it's very important. Our people actually argue that, okay, it's important that we actually ensure access to COVID-19 vaccine among the vulnerable and the marginalized population. So there are a lot of papers like that that we worked on, and we are seeing the impact. And currently, as a researcher, one of the metrics or one of the things that is actually used to grade researcher is the number of citations. And over the last 2 years of my activeness in research, my citations and the usage of my work has actually grew exponentially. So as a researcher, your H index, your citation actually shows how people are actually using your work. And currently, I have over 300 citations, and my H index is currently 10.
Oh, wow, that's impressive. So what skill, character attribute would you say have been invaluable to you in your career?
First thing, I believe in myself a lot. Like, one of the attributes that anybody should actually have to achieve a major success is believing in yourself. So I believe in myself, and I can also say being focused, having that determination and resilience. The key attributes I can say. And also basically being self-confident and believing in what you can do. It's not about pride, but it's about you knowing what you can do, knowing your limits. So those are the basic attributes I can point out.
So what will be your advice to young pharmacists that are looking to start a career for themselves in research?
I would say the first thing is to get a mentor. Get a mentor is very important that you get a mentor. But then personally for you, for someone that's actually interested in research, it's important that that person actually takes time to build capacity on their own. But okay, basically for me, I take my time to watch YouTube videos, because I believe in you making effort to self-learn. Even if you want to ask someone for help, make effort to learn. So when you are talking to that person that you want to learn anything from, that person will see that, okay, you have actually made significant efforts in that line, but these are the things that you don't actually understand. So building capacity, being focused on the fact that you actually want to learn research, because learning research is a continuous process. You have to keep learning. There are many methodologies that you have to just learn. So YouTube is available, books are available. Having a mentor as your backup is also very important. Someone that also serves as your role model in that field. I have a lot of role models that I don't even talk, like don't talk, or I check their works, read their papers, get more insight on how things are done, have insight about new journals that I can actually publish my paper in. So, but we don't talk, but then I follow them. Like I follow them when they publish, I know. I create an alert system to be able to track their work. Not that I'm trying to track them, but I'm learning from them. because not every time you have to just reach out to them. You can make your own conscious effort to look at how they do their things and use it to suit your own what you want to do. So, and have a mentor. So it's very, very important. Mentors, role model, and being you yourself, someone that's interested in research, should be ready to actually learn research. You have to be determined, you have to be focused. Another thing, as what I noticed that put many people off, is about writing. Seriously, the way I'm like, when you see when I actually check my previous posts on Facebook, I wonder at times, am I the one that write all these things? But then I make that damage. I want to improve my writing skills. So that's another thing as a young researcher that you have to focus on. So you have to read. So when I read, most of the time I don't just read. I look at the way people write. I look at how they construct their sentences. So from then, I also use that to build the capacity. So as a young researcher, having a good writing skill is something that is very important. You being able to write, and because at times what put many people off is that they don't know how to write. How do you take time to write all these things? How do you do this? So that is about building yourself in that line. So it will not be easy, but then your determination and being focused will actually help that person to pull through. Having a good writing skill, building that skill yourself, having a mentor, role model, being focused is very crucial.
So, thank you very much. You mentioned mentors. So, who are your own mentors, and how would you advise young pharmacists looking to get a career for themselves in research to approach mentors and be able to leverage these relationships? Mentee-mentor
relationship. Okay, wow. I have a lot of mentors. Yes. One is, I've mentioned one of my mentors earlier on, Professor Don Elisi Onizero 3, Pharm Adebayo, and many people like that. They serve as my mentor and help me in many things. So the idea of having just one mentor is not always true. You can have a mentor on a particular thing. Let's say you want to learn how to ride a bicycle. That person can be your mentor in that line. So it's about you knowing what you want and reaching out to right people. So maintaining mentor-mentee relationship, this is one of the things that many people don't still understand yet. Having a mentor doesn't mean that you just have to always reach out to that person and they always be asking, they always be doing, they always do this, always do that. No, that's not it. Maintaining that relationship actually takes conscious effort from the mentee side, in the sense that you want to learn about something. If you are someone that actually want to learn about something, you want to actually stick inside of a mentor on a particular thing. I think as a mentee, you yourself should have made that effort, that conscious effort to learn. So that if you make an effort to learn and you reach out to someone, that person will be happy. Okay, you've learned this, you learned that. Okay, this is done, and that they'll be happy to put you through. Than for someone to start from scratch and start doing this. You yourself have to make that conscious effort to grow. Another thing is mentorship should not be one way, not just one person is pushing towards you. It's very important that you also give back to your mentor. That doesn't mean that you have to buy them a house, you have to do just small things. You know that your mentor actually needs to do this. You mean, okay, this person is looking for this. Can I send this to the person? Okay. This person has a lot of papers to review. Can I assist in reviewing these papers? So you have to make it actually a two-way thing, not just one person put it towards you and you always receiving. So you should look for a way to build relationship with a mentor by always looking at, okay, what are the things that my mentor needs? You don't have to buy them a house, you don't have to buy them a car. Just simple thing that they can actually do. For instance, you can actually look at some things. For instance, you know that your mentor actually writes a lot, or your mentor helps people in reviewing their paper. You can, okay, can you please send some of papers to me? I can assist in reviewing. So that kind of thing. So you yourself have to make that conscious effort to sustain the relationship. And I'm sure your mentor will also notice all these things that you're trying to do. But then it's important that for a mentee, you make sure that it's a two-way thing, not that you are just always relying on your mentor. You have to make it a two-way thing so that both of you can actually benefit from the relationship.
How were you able to get this speed in your career?
Well, like in 2019, when I started writing more, so one of the things that's also very important as a researcher is collaboration. When you collaborate, it can also help you to be able to learn across board, to be able to meet new people, to share ideas and work faster. So I have the opportunity to work with a lot of people, with a lot of team, people reaching out to me for mentorship, discussion regarding research. So this makes it much more easier for me to learn from them, and also they also to learn from me in terms of research writing and publication. So I work across a lot of things, collaboration, and also mentoring a lot of people. So that makes me a lot more easier. So if you have an output from the work I mentor people on, surely I will also be part, because I contributed significantly to the paper. So it's possible that at times I have like 4 to 5 papers I'm working on. So because so it makes it very easy, and you being around the network of a group of people that actually we share similar vision and interest when it comes to research. So it's also very important, if you want to build capacity in any line, get the people, interested people that also share similar vision with you. That makes it much more faster to achieve your goals. So, but basically my focus is not about quantity really, but it happens that quantity is also there. So we also focus on achieving quality in whatsoever we do.
What about people that want to go into lab work, laboratory work? How would you advise them to go about this? Those that want to base their research on laboratory practical work.
Yeah, people. If you are interested in lab work, one of the things that's very important as a student or as a professional is to get affiliated to a laboratory. So you can volunteer in a lab. You can reach out to a PI, a principal investigator on a particular research. You can reach out to them and say, okay, you want to volunteer your time to learn from the lab. I'm sure most of them will actually accept you. So if you're training in lab work, it's very important that you get into a lab. So how do you get to the lab is by volunteering. Even if they're not paying you, maybe during the break or when you're free, you can just go and get someone or speak with a lecturer or a professor in a university that will actually help you to get into the lab. Then you can start learning and building capacity in that line.
Okay, thank you very much. Thank you. So, should we be expecting from you? What are your future prospects? What are the things you still want to achieve, even in your career?
Yeah, hopefully, one of the things I should be looking out for regarding me is to be more focused when it comes to the field of global public health research. So I'm sure you'll be hearing from me more in that area when it comes to global health research and driving health equity with research on the continent.
Okay, so we've dealt with research. So as a global health advocate, what exactly do you do?
Well, as a global health advocate, as a researcher, you're also an advocate indirectly or directly, actually, because as a researcher, you also give recommendation, give advocacy in a particular line. But personally, for me, I'm a global health advocate because I want to drive health equity by means of advocacy. For instance, some of my publication is purely on advocacy, advocating for the marginalized group, advocating for the vulnerable population. So I do my advocacy with research and also do my advocacy using campaigns. Currently, the owner of the group is about, now I think we're about 80,000. We have about 80,000 members on the page on Facebook where I share tips, information regarding health. And we have people from across the world on the group. So we're about 80,000 now. The name is Health Issues on Facebook. So where I really share information, regarding disease states, share information of COVID, share information on many things in the areas of healthcare on the page. So I also do my advocacy with research. I do my advocacy with campaign. And I also do my advocacy by building capacity, because one of the areas I'm actually advocating for is to engage more people in global health research, young people, to engage more undergraduate students, to engage graduate students more in research. So I also do my advocacy with research. I'm doing research to drive it. And I'm also currently advocating for research in Africa. So that's some of the areas that I'm currently advocating on.
Thank you very much. Earlier, you mentioned that you also mentor people. So how do you go about this? And for people that look to be mentored by you, how can they reach you?
Well, I mentor people based on their link, based on their need. Actually, even though you're interested in research, I create group for people that actually interested in research, where we discuss about research, share ideas, mentor them on how to start publication, share links to them that will help them. So a lot of my mentors on my list, I share links on available courses, trainings that they can attend that will actually guide them when it comes to research, and also link them up to people that are actually interested in their line. So people are not interested in global health research, but then I link them up with people that can actually guide them in that line.
Thank you.
Yeah.
So you're somewhat a poster boy, I may use that word, for research, for a young researcher in this climate. How would you say you've been able to handle this exposure and, in a way, fame that comes with this, and both the good and the bad, that comes with it?
Well, being a poster boy, primarily that's not the focus, or that's not the aim of why I'm actually involved in research. My own core reason, or the major reason why I actually engage in research, is to make impact. So I know it will not be easy, but then we should know that anything that is good doesn't come easy. So my core focus is to drive impact with my research and to contribute to growing knowledge in that line. So any other thing that comes along the line, whether good or bad, I know this is my core value and this is my own focus. So, and like anything that comes with anything that is good, you always have the path that is challenging. So that is expected of any position, of any career, of anything that you want to achieve in this life. So, because the major reason is not to use the opportunity to blow, or to, my primary reason is to drive impact. So anything that comes, good. So anything that the other way. So even if I have rejections at times, rejection mails and all this, I've learned to cope with them, because I know that nothing good actually comes easy. Because many people actually self-reject or stop trying when they have a lot of rejection. So we can't actually remove that part of rejection. What you should set as a primary aim, primary goal, is that you have something that you want to achieve, and you have the reason why you are doing this. So primarily, I have a drive and I have a reason why I'm engaging in all this, which is to make impact and also to contribute to knowledge. So any other things that comes, positions, awards, those are just normal things that should come with this kind of thing. But then that's not the primary focus. And anything that is challenging that comes along the line, like rejection, I've learned to cope with it, because I know it is not something that can be separated from success. They go hand in hand.
Okay. So I said, can you tell some of your achievements as a health system researcher? Some of your achievements.
Okay. Actually, I've won a number of travel grants to present some of my work in the national conference, like International AIDS Conference in Amsterdam, Netherlands. Also to present as a panelist on tobacco harm reduction, the state of tobacco harm reduction in Nigeria, at the Tobacco Harm Reduction Conference in Warsaw, Poland. And I've also emerged as a winner of a number of grants, like the Tobacco Harm Reduction grants, grants by Royal Society of Tropical Medicine and Hygiene, and many other small grants to actually advance my work in the field of global public health.
So any final words for young pharmacists? Any final words?
Be very conscious regarding your network, because your network, as they say, it determines your net worth. So it's very important that if you want to learn how to read, you have to move with readers. If you want to learn how to play, you want to learn with players. If you want to do anything at all, you have to have the right network, people that will motivate you, people that will inspire you to get better at anything you're interested in. So whatsoever anything you're interested in, get the right network, the right set of people that will actually guide you, that will actually motivate you, that even if you have rejection, you have that network of people that you can always reach out to. So it is very, very, very important as a young person to be conscious with the kind of network, with the kind of relationship that you build. So build a good and healthy relationship with people, and also be determined and be conscious of your growth. So it's very important as a young person that really want to excel in a particular field.
Okay, so thank you very much, Pharmacist Adebisi, for this interview.
Thank you for having me.